This video is going to introduce the concepts of attributable and absolute risk reduction. Attributable risk and absolute risk reduction allow us to ask the following question: how much of the disease that occurs can be attributed to a certain exposure? For this concept, we are talking about the total burden of disease. Whenever we look at the total proportion of people with diseases, we can assume that some people have disease because they are exposed to a certain risk factor. However, some people will still have disease even if they are not exposed to that risk factor. This occurrence of disease in people without this risk factor is called the background risk. For example, this would include people with lung cancer who have no history of exposure to cigarette smoke. Thus, the proportion of people with disease among exposed people includes some amount of background risk of people who would have gotten the disease anyway, and some additional amount of disease that is due to the exposure occurring. If the exposure increases disease, we see that the total percent of patients with disease is higher in the exposed group, and it exceeds the level above the background risk in the comparison or non-exposed group. If the exposure decreases disease, say in the case of vaccines, we see the percent of patients with disease is lower than the background risk in the comparison group. In the first scenario, where exposure increases disease, we call the difference between the two proportions shown by the red arrow the attributable risk. In the second scenario, where exposure decreases disease, we call the difference between the two proportions, again shown by the red arrow, the absolute risk reduction. When we evaluate the effectiveness of drugs, we focus on the absolute risk reduction because we hope that the use of the drug for exposure will reduce the occurrence in disease. To calculate the absolute risk reduction, we subtract the proportion with the disease in the exposed or treated group from the proportion with disease in the comparison group. The number needed to treat is simply 1 divided by the absolute risk reduction. The number needed to treat gives you the number of people you need to treat in order to prevent one case of disease. Why is this a good formula to know? Because the number needed to treat is often more understandable to patients than the relative risk or the odds ratio. This number also takes into account whether the disease or the adverse effect is a common or rare occurrence. This concludes the video.